Let's bring in NBC's Jeff Bennett. He's at the White House. I'm also joined by Dr. Anne Rimoin, professor of epidemiology and director of the Center for Global and Immigrant Health at UCLA. Doctor, stand by for me just a moment here. Jeff, walk us through what we just heard from the president regarding his administration's change in response, perhaps.
Yeah, Craig, and look, you ticked through the headlines, all the news coming out of that press availability. I'll give you a sense of who is in the room. You've got United Health Group, Humana, Blue Cross Blue Shield, Kaiser, CVS Health, so a number of the leading private health insurance companies. And as the president said there, they made a commitment to waive the co-pays connected to any testing. He says that's already the case for people who are on Medicare and Medicaid. The question is capacity. On Friday, the president said anybody who wants to get tested for coronavirus can get a test. Anecdotally, based on our own reporting, we know that's not yet the case, even though the administration is trying to get there with those millions more test kits being rolled out week by week, as the vice president said today, Craig.
Dr. Rimoin, I want to play something that Health and Human Services Secretary Alex Azar said just a few hours ago and get your response. Here's what he said. Okay, we don't have it, but I can paraphrase. Essentially, Secretary Azar, oh, never mind, we do have it.
How many Americans have been tested at this point?
We don't know exactly how many because hundreds of thousands of our tests have gone out to private labs and hospitals that currently do not report into CDC.
Well, now, Doctor, I'm confused because if that's the case, then how will we ever have accurate numbers?
Well, that's a really good question. The way that we get really good numbers is to have testing done in these hospitals, but the hospitals are generally reporting to their local health departments, and health departments share these data with CDC. So CDC is not getting all of this data directly. They're getting it from the local health departments. And so this obviously will take some time as testing is rolled out and reporting comes in. This is the case for all diseases.
So this number that we're working off of right now, 730 cases nationwide, is it reasonable to believe that is probably low, that the actual number of people walking around with coronavirus probably exceeds that?
Absolutely. I think it's very clear that there are many cases of coronavirus that we don't know yet. We don't have testing up and running. The fact that we've had failures in getting testing up and running has really slowed us down. We have no data to be able to tell us where we are in this epidemic. And so what we have to do is we have to follow the global data. And the global data suggests that coronavirus, once it starts hitting a country, starts spreading very quickly. I think that Italy is a perfect example of that. And if we don't take the example of the escalating risk in Italy, we're going to be sorry in the long run. I think this is very important to understand. The fact that we are not testing on a wide scale means that we have no idea how many cases are circulating in this country right now.
You mentioned Italy, total lockdown in that country at this point to stop the spread. At what point in our country would we have to consider implementing similar measures? How bad would it have to get?
I think we have a very different country here with different cultural norms. So a complete lockdown is going to be very, very difficult for the American people to be able to understand. We're already having trouble with people understanding how to do self-quarantine, what the difference between quarantine and isolation is. And I think that what we really need to do is we need to get ahead of the curve. Countries like South Korea, who did a very good job getting testing out and running, implementing social distancing immediately, getting people to stay at home when they are not feeling well, practicing good hygiene. All of these things are what can stop an epidemic from escalating as quickly. And what we really need to do is we need to slow it down because we cannot have our health system overburdened. And as as many people have been discussing right now, what we need is we need to flatten the epidemic curve so that hospitals are not overwhelmed.